All right, let's talk about something that can be, a bit alarming, but is super important to understand. Rectal bleeding. We're going to break it all down using the latest medical guidelines as our map to figure out what it means, what's causing it, and, most importantly, when you should probably chat with a doctor. And let's kick things off with this number right here, 1 in 5. What does that mean? Well, it might just surprise you. So here's our game plan. First, we'll see just how common this is. Then, we'll dive into the usual suspects, the most frequent causes. After that, we'll get into the serious stuff, when to be concerned, what risk factors to keep an eye on, and finally, we'll walk through exactly what happens if you go see your GP. Sound good? Let's get started. Okay, first things first, let's get some perspective here. Seeing blood can be really startling, right? But the reality is, it happens way more often than you'd probably guess. Remember that number I showed you, 1 in 5? Well, that's how many adults, on average, experience this every single year. So if this has happened to you, trust me, you are definitely not alone. It's really not that unusual, and the good news is, most of the time, the cause is something totally harmless. All right, so if it's that common, what's actually causing it? Well, it turns out that just a few things are responsible for the lion's share of cases. This chart really paints a clear picture, doesn't it? Just look at that big chunk for hemorrhoids, a whopping 35%. That's the number one cause by far. Then you've got anal fissures popping up pretty often too. And notice the slice for something more serious like colorectal cancer. It's actually a pretty small piece of the pie. So let's talk about the main culprit, hemorrhoids. Honestly, the easiest way to think about them is like little swollen cushions. They're just blood vessels that have gotten irritated. And what irritates them? Usually, it's straining, and that's when they can start to bleed. Okay, next up is another really common one, an anal fissure. The name sounds kind of intense, right? But it's actually just a tiny tear in the skin, almost like a paper cut in a very sensitive spot. And it's usually caused by something simple, like passing a hard stool. So the big question is, how can you even begin to tell these two apart? Now, obviously, you need a doctor for a real diagnosis, but here's a major clue: pain. Fissures almost always come with a sharp, really noticeable pain, especially when you're on the toilet. Hemorrhoids, though, they often just bleed without any pain at all unless they get complicated. Okay, let's shift gears a bit and talk about the less common, but more serious possibilities. And look, the point here isn't to scare anyone. It's about being informed so you know when it's time to take action. So while it's not as likely, bleeding can sometimes be a signal of something else going on, like inflammatory bowel disease. You might know it as IBD, which includes things like Crohn's or ulcerative colitis. Another thing doctors look for are polyps, which are basically little growths on the inside of the colon. And this is where things get really interesting with polyps. See, a lot of them are totally harmless, but there's a specific kind, called adenomas, that are considered precancerous. Now, that doesn't mean they are cancer. It means that over a really long time, we're talking 10, maybe even 20 years, they could turn into it. And that, right there, is why finding and removing them is such a game changer. Okay, this leads us to a really crucial part of our discussion, the specific red flags for colorectal cancer. These are the things that, when they show up alongside bleeding, make doctors pay closer attention. And the medical advice on this is super clear. We're not talking about one single symptom causing alarm. It's all about the bigger picture, recognizing when a cluster of symptoms and risk factors come together. That's the signal that it's time to get a professional opinion. So you'll want to pay really close attention to this list. These are the exact things doctors are trained to look for. Let's walk through them. First, age, being over 50. Family history is another big one, especially a close relative. Then look for any big changes in your bathroom habits, or things like stomach pain or losing weight without trying. And here's a really specific one. Is the blood actually mixed into the stool, or is it just on the outside or on the toilet paper? That's a key distinction. And finally, if there's bleeding but you don't have any of those simple explanations like a painful fissure, that's also something to note. So let's say some of this is ringing a bell and you decide to see your GP. What actually happens then? It can feel a little mysterious, but it's really not. The process is super logical and straightforward. Let's pull back the curtain on it. It really boils down to 3 simple steps. First up is just a conversation. The fancy medical term is amnesis, but it's really just you and your doctor talking through your symptoms, your family history, and all those risk factors we just mentioned. Step 2 is a physical exam to check for the obvious stuff, like hemorrhoids or a fissure. And then step 3 If anything's still unclear or if some of those red flags are there, your doctor will start talking about what further tests might be needed. And when it comes to those further tests, the gold standard for really getting a good look at what's going on inside the colon is a colonoscopy. All the guidelines agree this is the best tool they have to either definitively rule out something serious or to get a clear diagnosis. Look, at the end of the day, knowing all this stuff, from the super common causes to the much rarer ones, is all about empowerment. It's about helping you know the difference between, I should get this checked out, and needless panic. But remember, everything we've talked about, all this knowledge, it's just step one. The most important step is actually listening to your body and taking action when it's sending you a signal.